Everyone. Thank you for joining us for today's webinar, Tackling the Technician Shortage, a Proven Hiring Playbook. Our discussion today will cover a critical topic for healthcare leaders, tackling the technician shortage and best practices for hiring and retention. You're going to want to stick around for this entire discussion, as it will leave you with strategies to navigate this crisis. Before we begin, I'll walk through a few quick housekeeping instructions. We're planning for about 45 minutes of discussion, and then we'll open it up for Q&A. Please use the Q&A box you see on your screen to type in your questions throughout the webinar. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. The Incredible Health team will be in touch afterwards with that recording, and we'll also provide a demo link in the attendee chat shortly, and we'll follow up with that link afterwards. Lastly, if at any time you have issues with audio or visuals, just try refreshing your browser. You can also submit any technical questions into the Q&A box, and we are here to help. With that, I'm pleased to briefly introduce today's speakers, Dr. Iman Abuzeid, CEO and co-founder of Incredible Health, and Darlene Wetton, Group Vice President of Universal Health Services. Iman, I'll turn the floor over to you.
Thank you, Emma. Welcome, everyone, and thank you so much for joining today's webinar. I'll start with introducing myself. My name is Iman Abuzeid. I am the CEO and co-founder of Incredible Health. I'm an MD by background. I've been in software for the last 10 years of my career and founded Incredible Health about 7 years ago. Incredible Health is the largest software and AI-enabled career marketplace for healthcare workers, with over 1 million nurses and technicians now, and then over 1,500 hospitals that we support across the country too. Joining me today is Darlene Wetton. Darlene is the Group Vice President at Universal Health Services. In her role, she leads the CEOs of Southwest Healthcare, comprised of 5 acute care hospitals, ambulatory surgery centers, urgent care centers, and physician clinics in Southern California. Darlene has oversight of regional growth strategies. She leads the charge on quality, champions relationships, and drives integrations and efficiencies across the integrated network of care. She's also serves on the California Hospital Association Board of Trustees. She's also on the executive board of the Hospital Association of California, the Southwest Riverside County Legislative Council, and the Temecula Valley Chamber Board of Directors. Thank you so much for joining us today, Darlene.
Thank you, Iman. My pleasure.
Great. So today we're going to be covering a lot of ground, actually. We're going to be covering quite a few topics today as we discuss this emerging healthcare crisis related to technicians. We're going to be covering a brief overview of Incredible Health. We'll also be sharing the state of clinical technicians and the impact this shortage is having on health systems. We're also going to be diving deep with Darlene on a discussion with Southwest Healthcare and how they are tackling the technician shortage. We'll also be sharing technician hiring, retention, and best practices that you can implement at your organizations. And then finally, we're going to have time at the end for Q&A with both Darlene and I. So as Emma said at the beginning, please feel free to submit your questions throughout, and we'll make sure to get to as many questions as possible at the end. And a member of the Incredible Health team will be in touch after the webinar as well with the recording. And so you'll be hearing from our team too. All right, let's dive in. Okay, let's briefly start with just a quick overview of Incredible Health. Incredible Health is the largest career marketplace for healthcare workers in the US today. We are software and AI enabled. And so we have over 1 million nurses in the country on the platform, and we're now growing and expanding technicians on the platform. And we work with over 1,500 US hospitals across the country. Our team, it's made up of MDs and RNs and software engineers. We actually do not employ any recruiters. We work with fantastic talent acquisition teams like the ones on Darlene's team who get the value from the platform. We were founded in 2017. We're headquartered in San Francisco, and we operate across the country. As far as what we are, we're a two-sided marketplace, which many of you are probably familiar with, with Match.com and Uber and Lyft and Airbnb. These are all platforms that bring two parties together very efficiently using software. That's what Incredible Health does for nurses and technicians and for employers, including hospitals, surgery centers, and home health. We're bringing these two parties together very efficiently using software, and we are the Incredible Health team and software screens the talent ahead of time, pre-vets the talent, and makes sure they're custom matched as well to the employers. We also are big believers in a fantastic candidate experience, and we love working with teams like Darlene's team at UHS and in Southwest Healthcare in driving a fantastic candidate experience. We provide a whole range of resources and tools to the nurses and technicians on the platform, including a resume wizard, including access to career coaches and discounted continuing education, and a community where they can ask each other for advice. And we are often described as the best job search experience in my career. And we have thousands of 5-star reviews across Facebook, Google, the App Store, where we're often described as an amazing experience. As far as just our claim to fame, we provide sourcing and screening. So we give employers access to a large national talent pool. We also have AI technology integrated throughout the platform. For example, we use AI in our matching. We also use AI in helping nurses create resumes. And then we also have robust reporting and analytics. All right, let's next dive into what is the state of clinical technicians today. So we are essentially in the next major healthcare workforce crisis. It's not just coming, it's already here. The US is facing a shortfall of 3.2 million allied healthcare workers by 2026. That means we are missing over 3 million allied healthcare workers, which has the potential impact of delaying patient access to surgeries, to imaging, and to critical care. 85% of healthcare facilities today report facing shortages of allied health professionals. While the nursing and physician shortages get a lot of the headlines, the underreported growing need for clinical technicians is surging. And even though they make up over 30% of the healthcare workforce, technicians face long hiring timelines. They have limited visibility into career opportunities, and they have fragmented career development resources. So when I say technicians, I'm referring to surgical technicians, imaging technicians, clinical lab scientists. There's a whole range of different technicians I'm referring to. So let's next dive into what are the main causes of the shortage. So first is the aging population. So us as a country in the US, we have an aging population that's also growing, and that's contributing to the technician shortage in two ways. First is that there's more and more demand for services as our population ages. And then the second is that the workforce itself is also aging and retiring. We've also seen a 15% decline in training programs, which also contributes to fewer technicians entering the workforce. And then finally, there's competition from outside of healthcare that's enticing technicians to leave the field. And so that's another emerging trend that's happening for this workforce. So there are some major headwinds that healthcare leaders are tackling, and we'll be hearing from Darlene shortly about some of these headwinds as well. Healthcare employers are facing a 21% increase in labor costs since the pandemic, with a 10% growth in costs from 2023 to 2024 alone. And then inflation is also contributing to the growth of labor costs in 2025. In addition, there's 600,000 healthcare professionals that resign every month, and that's further stressing the vacancy rates and putting critical services at risk. And this is leading to an average operating margin of 4.9% for hospitals, which is down from 5.3% from the previous year. And 37% of hospitals are losing money in 2024. So labor costs continue to be a big theme and a big priority for healthcare leaders across the country. So how are healthcare leaders responding? So most health systems are leaning on temporary labor to address the shortage, including the technician shortage. We saw this with the nursing crisis, where it was used as a Band-Aid solution to address labor shortages, and we're seeing this now again with technicians. Healthcare leaders were also faced with the decision to pay significant premiums for temporary labor or risk significant delays. And then now healthcare leaders are running some of the same playbook that they ran with nursing a couple years ago to combat the staffing challenges with clinical technicians. We've spoken with healthcare leaders across many of the 1,500 hospitals that we support across the country. And a common thread is that there's been a temporary labor spend increase for technicians that has now surpassed that of the temporary costs for nursing. And it's now the highest temporary labor spend category that health systems are facing. All right. Last thing I wanted to mention before introducing Darlene to the conversation is that the impact that this is having on health systems. First is the critical patient care delays, delayed diagnoses, postponed procedures, and increased wait times compromise patient care and satisfaction. So that's the impact of the technician shortage on care. We're seeing longer wait times for imaging and diagnostics, which can limit early intervention. It delays discharges, and there's other bottlenecks related to patient flow. And then in emergency departments in particular, a lack of technicians can delay triage and lead to patient walkouts. Surgical delays can also push patients to seek care elsewhere. The other thing we're seeing is we're seeing revenue losses. So delays and disruptions in medical imaging or lab diagnostics or surgical and other treatments it does directly impact hospital revenue. Surgeries today account for 50% of hospital revenue in the typical health system. So their efficiency and throughput in that area in particular is critical to driving revenue. And then finally, we have rising operational costs. We're seeing an increase in overtime pay and temporary labor costs. And the temporary labor costs is around 88% to 140% higher than permanent labor. And so that's driving millions of dollars in added labor costs in an environment where operating margins are tightening. And then finally, there's increased staff burnout. When you have a shortage, you're often asking the technicians to work longer hours, which increases their stress and burnout, which further contributes to attrition. Burnout costs in the US healthcare system across the country costs $4.6 billion annually, with the greatest burden attributed to turnover and work hour reductions. All right, so let's next bring in Darlene to the discussion. Darlene, we'd love to hear more about how you're thinking about the technician shortage at Southwest Healthcare.
Well, let me start a little bit about Southwest Healthcare, as you mentioned before. So we consist of 5 hospitals in Southern California, and also surgery centers, ambulatory settings that I have a responsibility for. A lot of our partnership is because of the fact that we are part of a large organization. So UHS owns and operates Southwest Healthcare. UHS is a Fortune 300 corporation located in 39 states, Washington, D.C., Puerto Rico, and the United Kingdom. And so it's a good partner for Incredible Health because you also have a national presence. And so the partnership has worked out really well. So many of the impacts that we've seen on the nursing shortage, we're now experiencing with the technicians and technologists in this space. And as you mentioned, the patient care delays are significant and potentially could be in the emergency room, where we rely oftentimes on a CT scan to diagnose and determine the eventual disposition of that emergency room patient. And if we have a shortage of imaging technologists or CT technologists in this case, that can really bottleneck the ER. The operational costs, as you mentioned as well, we are reliant on temporary labor cost for technologists and technicians because of the fact that this is such an important talent workforce that we have and represents about 1/3 of our workforce in the organization, as you mentioned. So we have about 8,000 employees in Southwest Healthcare, so 1/3 of them impact on our operational cost as well as the workflow within the hospital. The revenue loss that you mentioned can be significant, particularly if it impacts our surgical ability or cardiac cath technologist. In many of these settings, the physician and the team, these are the key players. This is oftentimes, and I hate to say this because I am a nurse, but the technologist technician in these settings is oftentimes more important to the team and to the surgeon than the RN in the room. And so if you have a shortage in the cath lab or your shortage in the OR, that times can delay a case or postpone a case if you don't have the adequate talent in that setting. So that all impacts, really the employer in this case, which is Southwest Healthcare.
Okay. So yeah, they're playing a critical role. They're a valuable player on the team. Curious, Darlene, when did you start noticing these challenges start? When did they become more pronounced?
Actually, I think it's always been pronounced. And I think as you've shared, we get a lot of attention on provider shortages, which we spend a lot of our attention on, as well as the RN shortage. really impacted during the pandemic, where we were having shortages across the board. But I think maybe a little bit too much attention was paid to the RN and replacing the RN and the impact we were having, and less of a focus on the technician and the technologists that were, equally, if not more valuable in the setting to continue to operate the hospitals. And so I think it's been progressive, and now it's really got a flashlight because we've made strides in reducing premium labor for the RN, and it's taken over now by the technical field. And so we're seeing kind of that shift where, we made success, and now we've got to change our focus and attention to really address this important workforce.
Okay. And would you mind just speaking a bit more to how the changes in the technician workforce impacted Southwest Healthcare?
Yeah, I mean, we have had delays in surgery. We've had to cancel surgeries and reschedule if we have, such a thin workforce and don't have that strong bench to call in somebody. If we've got a leave of absence, we'll bring in a traveler or premium labor to replace that individual. Also, I think one of the challenges we have is we hold out for key talent, and I'm sure we'll be talking about this a little bit later as well. What we call multimodality for the imaging technologist, getting somebody experienced that has that kind of skill set where they can, manage MRI, CT, ultrasound, and general fluoro. That's a highly operating, well sought after individual. And we're all fighting for that same talent and really focused on somebody who's got that much flexibility to be able to serve, across multimodalities. Has been challenging to find someone like that, and they're in demand.
Yeah, they're definitely. So would you mind, Darlene, describing a little more about what your recruiting process looks like for technicians?
Yeah, it's not great. And I think we'll be talking about this a little bit when you get into kind of the success we've had at Temecula Valley Hospital, partnering with Incredible Health on the RNs. We have a traditional model. We wait for someone to apply based on a posting. We have, a traditional recruiter who's recruiting for all kinds of talent. We have a RN recruiter, and then we have a recruiter who focuses in on, EVS, admitting all the different departments, non-RN, in addition to the clinical technicians and technologists in this category. So it's a lot of responsibility on talent acquisition to seek someone who might have a professional degree as a technologist, as well as somebody that's having, a high school degree for EVS, or even some levels of surgical technician may only require a high school degree. So it varies, and it's a lot of responsibility to wait for somebody to contact you who's also contacting many other employers. And then we go through the process of screening and vetting that candidate.
Got it. And is your team primarily relying on more traditional methods for recruiting? So posting jobs. Imagine, does your team do job fairs and
up until just recently, when we've had the opportunity to partner with Incredible Health. And I think we're just learning, as much as we've learned from the RN recruitment side of it, we're now applying those same learning and opportunity onto the success that we can have with Incredible Health. So we've just started to begin to source, with candidates that are now being pushed to us using your model.
Okay, got it. Awesome. So as far as just if we would just do a quick case study on Temecula Valley, Incredible Health works with several UHS hospitals now, but for Temecula Valley in particular, we're able to hire in a range of specialties. So for on the nursing side, and we're just getting started on the technician side. So on the nursing side, we were able to hire in med-surg, in the ICU, in emergency. Those nurses averaged 8 years of experience and 22 days to hire. The other thing is the other piece of this is that we know that the Temecula Valley recruiting team has a pretty good grasp of their local talent pools. But the one benefit of using Incredible Health is it gives a smaller hospital like Temecula Valley national reach, right? So the team has been able to take advantage of talent that's relocating from other parts of the country to Southern California, which is great.
Right.
So. Can you, would you mind just sharing a little bit more about the technician specialties that you're finding the hardest to fill?
Yeah, we focused on two key areas. One was the imaging technologist, again, back to that multimodality concept that I shared, as well as the surgical technicians. Those two key areas is where we wanted to start. And there's a lot of needs certainly for pharmacy technician, clinical lab scientist, several different categories, but those were the two key areas where we had the biggest struggle and the most reliance on premium labor, either our own staff working additional shifts, picking up overtime, or bringing in travelers to replace when we have leave of absences or vacancies. So those are the two key areas we wanted to start with.
Okay, and can you comment a little bit about your team's desire to bring in new graduate technicians versus more experienced technicians, and how you think about the training for them as well?
Right. Yeah, that's been one of our traditional models. We partner with schools, and there's not a lot of schools in Southern California that really support this talent and the development of new talent. And so when we've got the opportunity to partner with a school, we do that and bring in somebody during their student rotation, and hopefully they turn out to be, an incredible opportunity as an employee, and we transition them over to employment. But we continue to train them, which can be expensive. And oftentimes, particularly in imaging, they'll start out with a single modality, and then eventually we'll have to train them into the multimodalities, because that isn't something that's being offered. At least the schools in our area aren't providing that type of training. So it's a pretty significant investment in someone. And then when they get that skill or talent, they may leave us, for an opportunity, someplace else with the competition after we've invested in them. It's the same thing with for example, a cath lab technician. That can take us 6-8 months to train somebody who hasn't worked in a cath lab setting before. We'll bring somebody in new from school, or one of our current employees who's interested in transitioning. Also a lot of front-end cost and expense. So having the opportunity to find experienced individuals is really significant to Southwest Healthcare to be able to do that. Gives us a lot of opportunity. Then that individual can mentor somebody else that we might be bringing in new and serve as that trainee.
Okay, so to summarize, when it comes to hiring technicians, the reason it's so critical for Southwest is, of course, it's about delivering patient care. It's also the need to keep reducing temporary labor costs. It's also an opportunity for those that are there to offer training and education. Anything else in terms of just why this workforce is critical to Southwest Healthcare?
I think the other aspect is we're introducing, new programs and services. There's a lot of advancement all the time, new technology, new robotics, new AI, and the opportunity to develop those revenue generating service lines. Many of them are very reliant on, the success and experience of the technical workforce. And so we can't introduce something new if we don't have the talent, to support it. Yeah, a lot of retention, I believe, really relies on effective leadership and how we treat employees and how we really embrace them in their workforce, how we take care of employees. And so I think, leadership effectiveness is huge with any employee, but I think in this particular setting, bringing in somebody with experience, they're looking for a great culture, a great opportunity, an opportunity to make an impact on patients. And so involving them in new programs, giving them career growth opportunities, I think is really key to the success of retention of any employee, but also this particular group of workforce is going to be, important to us in order to retain and not lose the valuable talent that we might be bringing in.
Yeah, great. As far as the work with Incredible Health, what would you say are some of the top takeaways that your team has had from the partnership so far?
Yeah, we've learned a lot. And that's really one of the things that I really enjoy is the data that's available to us on every aspect of the talent acquisition. And it's really, I have to be honest, I hadn't focused on it the way that I focus on it now until I was able to see the data on how we are bringing in talent and what the recruitment process is and the engagement of our team and how basically clunky we were in doing all of this. And until someone shows you the data of how long somebody sits in a queue or how long it takes to get to the hiring manager or the various, basically clunky processes that we have in place, and we lose candidates quickly because we weren't focused on speed. And still being able to hire somebody experienced, we've learned a lot and able to overlay what we use for our RNs then into other settings because it's the same team, so having a highly engaged HR team, a highly engaged, recruiter is a great start and made a huge difference, particularly at Temecula Valley Hospital. But then you've got to engage the entire C-suite. And if you don't have, the chief nursing officer really understanding the value of how we treat these candidates in the front end, and your CEO, then the whole thing falls apart again. So, we learned as we went on really having everyone understand the data and then getting that constant feedback of data. So I would know, for example, we were having a shortage of a particular area, and I would ask, okay, what's the block? Well, the block was we weren't willing to hire from out of state. And that's huge because this is such an opportunity with the million nurses that you have across the country. And many of them were interested in coming to California, and yet we were saying no. And the reason for that was, the immediate gratification that I want to hire a nurse now and I want them to start tomorrow. And that's great. But we're still going to have that opening in 60 or 90 days because of the number of openings that we have. Let's hire for the future as well. And in particularly, unfortunately in California, it takes about that long to get a California license as an RN. So, it's that willingness to go ahead and hire, go through the process of them getting their RN license because you're going to have a great experienced nurse. It's just going to be in the future. So as soon as we started saying yes to that relocation and that out of state, that really opened things up for us. And we're going to need to do the same, absolutely, for the technicians and be willing to bring in from across the country and help individuals. And sometimes it takes longer to get that hire, but then you've got that great experienced individual and you're not just fishing in your same pond all the time and sharing technicians within, 8 different hospitals in your area. You're bringing in people who are relocating for other reasons, and you're able to get that experienced talent. So I'm really excited about the opportunity the success we've had, at Temecula Valley Hospital with the RNs in really hard to fill specialties, being able to get an average of 8 years of experience for these nurses, in an ICU and a cardiac cath lab and these really difficult to fill areas is significant because otherwise we'd be doing, training programs and new graduate programs and new to specialty programs, which we will continue to do, but not to the level that we've had to because now we've got experienced nurses instead of always relying on that new graduate.
That's great. And then have you seen temporary labor costs come down as well on the nursing side?
Oh, yeah. We had, horrible peaks, as you can imagine, during COVID with traveling nurses and our reliance on premium labor. And we were beginning to make strides. And we would get down to, for example, at Temecula Valley Hospital, at one peak, we had 85 travelers. Now I believe they're down to 6 or 7, right. Just to give you an idea of how significant we've been able to reduce that by bringing in, I think we're up to 30 RNs now that we've brought in with Incredible Health.
Great. Fantastic. So that tees us up for the best practices. So you shared some of the key learnings you've had from the partnership and from the focus on talent acquisition. I'd love to spend a little bit of time together on the hiring and retention best practices for technicians. We'll make it technicians focused. The first one I wanted to mention that we share with all of our partners as well is no nurse left behind. Now it's no technician left behind. Most healthcare workers, most healthcare leaders we speak with are very focused on hiring permanent and experienced technicians for units and roles and locations, and assessing candidates for one specific role at a time. The idea of the no technician left behind approach is it allows teams to really capitalize on talent for their health system and prevent them from going to the competition. essentially what the no technician left behind philosophy is when a technician is engaging with the recruitment team. The recruitment team is trying to understand what the technician wants more broadly, as well as understands what the organization needs more broadly. So even if the candidate is not necessarily a perfect fit for a single role, we need to make sure we can quickly pivot them to other roles that they might be interested in and that they might be a fit for. And so the idea here is that there's no technician left behind when you're engaging with them. Just curious to hear about your experience with this sort of philosophy, Darlene, as you've rolled it out for nursing and now it's happening with technicians.
Yeah, I think this is another learning opportunity for us. And one of the things, we've had to pivot and change how we focus on nurses as a result of our partnership. It's the same thing we're seeing early on in our partnership with Incredible Health as we've begun to look at technicians. Our traditional model, as you shared, is we hold out for experience and we hold out, like I explained, for imaging modalities, we hold out for multimodality. And what we're going to have to do is we're going to have to pivot that thinking. If we're able to find someone who's a very experienced, CT technologist, for example, that potentially is a great hire. Don't leave that individual behind. Bring in that individual, and then we'll train on the multimodality instead of holding out for that. So I think that's part of our opportunity is, don't get so stuck into how we've always done things. Look at, okay, this is a great individual. How are we going to bring them in? And make this, a success for both them and for us by not being so rigid in our thinking about, the talent pool or how we've always done things. It really makes you think about things a little bit differently. So I appreciate that challenge, and we're starting to learn that early on in the process.
Great. Other examples from other partners we've worked with in terms of the no technician left behind philosophy is more flexibility on geography, right? So we still work with some partners who only want to hire from their state or from their local pool, but increase the flexibility for relocating talent. And a common one that came up with nursing actually is the flexibility around a bachelor's versus an associate's degree. And Magnet was often quoted as the reason for why we only want bachelor's, but actually when you look at the Magnet guidelines, it's not that strict. It's not as strict as leaders say. And so really having openness to nurses that have an associate's degree but a lot of experience could be just as great as someone with a bachelor's degree as well. So really just opening up the flexibility and being a little less rigid is key for the no technician left behind philosophy. The next best practice we want to spend time on is creating an efficient hiring operation. Here on the slide, we have roughly, everyone roughly has the same 9 steps in their hiring process. And as Darlene mentioned earlier, speed is the name of the game in healthcare hiring. And we have so much data that shows that 61% of nurses accept the very first offer they receive, even if the subsequent offers are at have a higher salary. We also have shown that when you look at a single market, let's say the Southern California market, and you have an employer there that has a huge brand, you also have another employer that has the highest salaries in the region, and then you have another employer that's just moving very quickly in their hiring operations, and candidates are able to get through very quickly. That third group, the team that has enabled speed, actually ends up hiring more than the employer with the biggest brand or the employer with the highest salaries. So that really speaks to how speed can really become a huge competitive advantage if we can just continue to work on the speed of the operations. One of the things that we do is to enable more speed is to really identify what are the opportunities for improvement in this process and where are the bottlenecks that we need to address. Is it at the phone screen step with the recruiters? Is it getting the candidates to the hiring manager interviews to get them scheduled? Is it about getting offers out? And so measuring each of these, including the speed data in each step, as well as how well is candidates converting from one step to the next, helps us as leaders identify bottlenecks as well as celebrate successes. I mean, some parts of this funnel are sometimes working very well. Would love to hear just a little bit about your experience with driving the speed at Temecula Valley as well as Southwest more broadly.
Yeah, this has been a lot of fun, and you're absolutely right. I had no idea the importance of speed in this process until I started seeing the data and hearing the impact and the stories. And so I really enjoy, all the different breakdowns of the data that I'm able to receive in this process, because it quickly identifies where's the bottleneck, where are things getting stuck. And I didn't realize all the variations we had in this process across the 5 hospitals in Southwest Healthcare. You'd think we would be a system and operating like a system, but the processes were very different. In some areas, for example, a panel interview was part of the process, which is difficult when you're trying to bring in a nurse from Texas into California who's got 15 other opportunities, and yet we're relying on scheduling the panel interview, which could take a week, 10 days. I think the other opportunity really was on the front end, how quickly did the recruiter reach out and make that connection, and able to compare that with how quickly are the competitors doing that particular aspect of it. And the team's very competitive. And as soon as you share the data with them, either within the 5 hospitals as well as against the competition, they could see, okay, I'm not going to accept that. We're going to improve. So like I think one of the slides showed, the average is 86 days, and Temecula Valley Hospital was get down to 22 days. Well, that took some time and some energy and a lot of changes in processes to get there. But they're there, and they're one of the strongest across the country now, I think, as your clients and their processes. And that's why there was the opportunity then, okay, we've been successful with RNs, let's move on to the clinical technicians. Because of this team and what they're able to accomplish, there should be great success. But it takes the entire team. And if you don't have, that really, engaging recruiter, that really engaged, CNO and CEO and HRD to really hum this together, it doesn't work. And so it takes everybody. It isn't just getting all this talent pushed to you, which you do a great job of doing. If you don't act on that talent, you lose them quickly if you don't have that speed in those processes.
Absolutely. Yeah. I just really wanted to highlight the multiple leaders that are involved in driving the speed. When we do our most successful partnerships have not just the HR leadership engaged and the recruiters engaged, but also sometimes the nursing leaders, sometimes the CEOs involved, sometimes the COOs involved, because it takes multiple parties to get someone hired. In most cases, recruiters cannot do it on their own. There's hiring managers involved, and there's other factors as well. You're right that Temecula Valley is one of the fastest hospitals in the country when it comes to hiring speed now, and certainly one of the fastest in Southern California. There are actually many cases where we see that the Temecula Valley team has sent out a job offer before a competing hospital has even scheduled their hiring manager interview. And so probably the top reason why speed matters is that this hiring is highly competitive. When it comes to hiring experienced nurses and experienced technicians, you're not one employer is not the only game in town, and there are multiple employers, and there's a lot of competition for this talent, even outside of Incredible Health, right? So speed really is the name of the game. The next best practice I wanted to walk through is knowing the business impact. So having a clear understanding of the economic impact of staffing is critical in order to create a plan to combat the shortages. And that clarity of what the impact of the staffing is needs to be understood by not just the HR leader or the CEO, but it has to be understood by multiple leaders and certainly by the recruiters as well. So having a data-driven mindset helps understand several aspects. One is like revenue by specialty, right? What services are critical to driving revenue, and what are the staffing demands to keep those services operational? And so understanding your economics for technicians across your various service lines and your various specialties is key. And that helps really help prioritize which staffing gaps need to be addressed, and get everyone on the same page about the speed in which they need to get addressed as well. Should also, that's on the revenue side. On the cost side, it is a best practice for everyone on the team, all leaders, to understand the premium labor costs and the temporary labor costs, not just of temporary labor, but even overtime costs sometimes as well, and to forecast that as well. So understanding these calculations can help shift priorities, budget, so on, to addressing temporary labor expenses, and increase the priority of increasing permanent workers faster. Would love to hear your perspective on this, Darlene, just given given your role, on how has Southwest Healthcare taken a data-driven approach when it comes to ensuring you have appropriate staffing?
A lot of the things that you shared, I mean, we certainly measure, premium labor. And for us, that includes both the overtime as well as the reliance on either travelers or local registry. So we consider both to be, premium labor cost to the organization. And labor, as you know, is our most expensive cost in healthcare is the labor impact. And how we measure that on a, by pay period, by day, by month, certainly comparing what our costs are and where they're trending is oftentimes important. And anticipating either new service lines, opening of new programs, that labor impact is really important as we're looking at a pro forma, to open up new services. That drives into that. And so if we're anticipating we're only going to be able to open the new program if we bring in, 10 travelers to do it, it may actually slow down or close down the program until we're able to make sure that we can really bring in the talent that we need. That's our own employed talent. And so we use that data to make those kind of decisions as well as far as, opening new services. We're getting ready to open, 4 new cath labs in Southwest Healthcare. And that's going to be really important in order to have the talent to be able to do that and to do that successfully. That'll quickly drive into our margins if we don't have, the technologists, the technicians, and the nurses to be able to provide that service in this market. Because, we won't be able to do it successfully. Plus, we won't have the confidence of the surgeons or the cardiologists if they're having to rely on temporary labor. They won't support a new program as well. So we use data consistently to measure our impact and also trend the impact that we have on reducing our reliance on premium labor.
Great. So to summarize the 3 main best practices that we covered today for hiring technicians successfully is, number 1, no technician left behind. Number 2 is create a speedy hiring operation. And then number 3 is know your numbers, know the business impact, both on revenue and on costs of staffing. So great. We'll next do some Q&A. There's a lot of questions that were submitted, actually, Darlene. Okay. So for both of us, one question is on the retention piece, Darlene. Has your team considered offering special promotions or could be sign-on bonuses or relocation packages or whatever it is for your technologists to help drive retention?
Yeah, we do have those programs in place. Tuition reimbursement oftentimes is important. Relocation assistance is important. Career opportunities for career growth we provide. So a lot of those retention factors have really been successful for us, and we do all that. We also recognize, really the impact that these individuals can have on the patient experience. And, for the RNs, we have the DAISY Award, but for the clinicians, we have the B Award, which is very impactful. And we get nominations from patients, from families, really recognizing those technicians that made an impact on their lives, and in their healthcare. And then we recognize them on a monthly basis with special awards, recognition. Their department recognizes them, the entire hospital, and then they get invited as well to the governing board to be presented as a clinician who's really made a difference in the care and lives of our patients.
Great. Anything? We've heard from many of our partners that for the first time they're offering sign-on bonuses and relocation assistance for technicians. That is something that has not happened in health in the last 2 decades, maybe. And so that's something new. I know that's a tactic that was used with nursing a couple of years ago, but now we're seeing it more frequently used with technicians. Great. One question that came through is, how do you think about hiring speed versus ensuring you're hiring the best candidate? I'm sure your team has had all these debates. I have thoughts on this too. Go ahead, Darlene.
So that it doesn't speed up your interview. So it speeds up you're reaching out to the candidate. It speeds up how quickly you schedule the hiring manager interview, but it doesn't speed up the actual interview or the quality of that interview process. The interview may not be in person, and oftentimes isn't in person. It's a Zoom interview. So that would be, maybe the downside. But I have to tell you, of the 30 nurses that we've been able to hire, these are excellent individuals. They're all very high quality. They're doing a great job. We haven't had any bad hires as a result of speed. But the speed is really on the process, not the opportunity to have a really high quality interview with the individual.
Yep, exactly. So definitely not compromising on quality, but we're focusing on operational processes. So the speed in which candidates get to the recruiter, the speed in which they are scheduled with the hiring manager, the speed in which the hiring manager interview gets completed, and the speed in which offers go out. And so those are all very operational in nature, certainly not changing the actual interview itself.
Right.
Great. Question came in for me. How did you find out the data from the competition on time to contact at the front end of the hiring process? The data came from our marketplace. So because the marketplace is software enabled, we're able to track a lot of information automatically. And so we share that speed data with our partners in terms of what are the local benchmarks as well as what are the national benchmarks for how quickly candidates need to move in each step of the process. Question on for you, Darlene. When thinking about the no technician left behind philosophy and thinking about more flexibility, are you also changing your job postings to reflect that mindset, to be less rigid, or the job postings staying the same?
Now we're having to change our job postings as well, and I think, the same thing we have to consider also with flexibility. Does it make more sense to have, 3/12s, 4/10s, those kind of alternative work schedules as we're looking at talent as well. And if somebody's gonna, has that need, and yet we're set on particular work schedule, then we need to be able to, again, to have that flexibility to look at, okay, what are the individuals coming in with and what are their needs? And do we need to make it a change? And therefore, we would change the job posting for that as well, should that come up.
Okay. Another question that came up is, and we see this all the time, how did you overcome the internal barriers or challenges that you faced when it came to accelerating hiring speed? You mentioned earlier that there's multiple parties involved, everyone needs to be aligned, engaged. How did you ultimately get everyone to agree?
Several different approaches, actually. I had so much success at Temecula Valley Hospital. It just seemed so obvious to me that this would be, able to be replicated across the other hospitals, and that wasn't the case. So I really had to engage each of the individual teams, understand, what their needs were, what their differences were, and then I partnered a lot with Incredible Health. I mean, we had group meetings with the CNOs, we had group meetings with the CEOs, we had individual meetings, and just kept sharing that data and have frequency of calls and frequency of feedback. And then, like you mentioned, celebrate the success as well. When somebody was able to move a metric, by 10 minutes or 15 minutes, that was a huge victory. And be able to really recognize that team and their success in hiring. The first time that a hospital hires a nurse for the OR, that's a huge deal. And they thought they'd never be able to fill that position. So those really critical to fill openings are impactful, and then share it with everybody else. I mean, they're competitive as well. They don't want somebody doing better than they're doing in this space. And so being able to share those successes as well, and recognizing, their margin improvement as they're reducing premium labor costs is pretty important to the CEO, I've got to tell you.
Yep, great. This question, I think, was for me, came from Christine. Can you talk more about the 15% decline in training programs and what type of training is declining? That's a external data that we found that showed that the training programs for technicians in the US, so training people to become technologists to begin with, have declined by 15%. I think perhaps our team can follow up with that source as well, so we can share more info on that. It's a great question. Great. And thank you to Wesley and Jeremy. You're right. We shouldn't even be saying technicians. We should be saying technologists. Apologies. You're right. We should be saying technologists. We know question for you, Darlene, with such competition for technologist talent, have you noticed any trend towards technologists requesting or prioritizing flexible scheduling options?
Yeah, definitely. There's a lot of individuals that, would prefer not only the flexibility of a work schedule, but they're working more than one job oftentimes. And so if there's a requirement for, let's say, call, that's going to be important because, they certainly can't be on call for multiple different settings. And so if our call requirements, are high, which oftentimes they are, particularly, in imaging or in the surgical areas or cath, and yet they're trying to work a second job that also has call requirements, we have to be oftentimes flexible with, how we're going to schedule them and be able to accommodate, those two different work schedules.
Yeah, we saw that same trend with nursing. In fact, it was a key tactic that leaders put in place to drive up retention, is to offer more flexible scheduling options, and that tended to improve hiring as well as improving retention. So I won't be surprised if that starts getting offered to technicians as well, more flexible scheduling options in the coming months. Great. So another question that came in for you, Darlene, is have you found success in using current technologists as recruiters or as ambassadors for bringing in new talent? And if yes, can you speak to some of that?
We certainly have with schools, and we bring out, the existing talent and talk to students, introduce them. Some of our leaders will do that as well. But that's been important. And if you can get somebody in front of, a high school, for example, and talk about their career and their field and their passion for it, that's much more impactful than me going out to the school and talking about it. So that really introduces somebody into the field, I think has been important. As an ambassador to really represent how important this is to the healthcare industry and the difference they make in the patients' lives. I think people really want to work where they can make a difference, and this is a great opportunity to do that. And so I think we've used them a lot successfully as ambassadors in that role.
Okay, great question came in from Zach about online training programs. Have you explored partnerships or any interaction with online training programs to help fill the pipeline for technologists?
As with all schools, some of their training is online and a lot of it's in person as well. We haven't done a lot with online, in partnership with academic centers. We have our own online training program within the hospital settings for career advancement, for ongoing education and training, but not in partnership with a academic setting.
Okay, great. I think we've gotten through a lot of the questions. A couple others. Have you, Darlene? I know Southwest Healthcare includes surgery centers as well, right? Not just the hospitals. Have you seen the competition vary between these two care settings, surgery centers versus hospitals, when it comes to technologists? And curious if your organization provides training in the ambulatory settings too.
Yeah, it's interesting. There's a lot of change going on right now in the ambulatory setting. I think, they're growing. There's a lot more centers opening, a very competitive market. It's attractive, I think, to an RN or a technician because of the fact that there's not the call requirement. It's more of a Monday through Friday schedule, which can be very attractive. Pay rates are different between hospital settings and ambulatory surgery settings. And so it's going to be interesting to watch and see if that transitions to be more aligned because there isn't the demand of the call It's a lesser paying environment, but people are willing to do that because of the work-life balance that they get of not taking call or having their weekends off is oftentimes really important to, a young parent in that setting. So I think we're going to see a lot of changes coming up in that space, but certainly an opportunity to really get somebody who is really skilled at that setting, because it's different. It's a different environment and a different setting with different expectations of the surgical team as well as the population and what they expect out of that kind of a center. So I think there's an opportunity to do a lot more in that space, and we're going to have to focus on that as an industry.
All right, fantastic. So we're just wrapping up now. This webinar is recorded. It's going to be sent out through by the Becker's team as well as by the Incredible Health team. And if you have additional, we were able to get through the majority of the questions, but if there's additional questions, you're welcome to send them to questions@incrediblehealth.com. Our team also shared our request a demo link as well in the chat. So you all are welcome to request a demo or meet with our team. Darlene, thank you so much. This is fantastic. Really appreciate you sharing all the information and the experience that you've had so far at Southwest Healthcare and how you're thinking about this challenge, the technologist shortage challenge, strategically, both on the hiring side and on the retention side. So thank you so much.
Thank you. Have a great day.
All right. Thanks, everyone.